So we're not out of the woods yet, but we are moving forward. And that's what I want to talk to you about now. What's next? Over the past year, we've been pushed to think outside the box, to work in new ways, learn in new ways, socialize in new ways. One thing is clear. We can absolutely do things differently. So this legislative session, let us challenge ourselves to envision new ways of making Louisiana better for all of our citizens. Tragedies like the ones we faced often remind us of our shared humanity. But then things start to get back to normal and we forget that for some, the road to recovery is much longer and more difficult. Like you, I want Mardi Gras parades to roll again. I want festivals to resume. And I certainly don't want to have to wear a mask all the time. But I don't want post-pandemic Louisiana to look completely like pre-pandemic Louisiana, nor should it, because we can do better. The pandemic has highlighted inequities that have persisted in our communities, especially when it comes to health outcomes. These inequities were not created overnight, nor will they be eliminated overnight. They're the culmination of years of policies and neglect that our communities of color and low-income populations have borne for generations. If we do not address these issues now, we are doing a great disservice to people who have already suffered so much. That is precisely why early in the pandemic I established the Health Equity Task Force. It's why we rolled out the Bring Back Louisiana campaign, or working to ensure that all communities have access to the vaccine. It's also why I created the Resilient Louisiana Commission, to ensure that small businesses that have been devastated by this pandemic have a seat at the table and a path forward. Through this work, we have safely reopened our economy and are quickly making up the ground we lost to the pandemic. It's why 5 years ago I expanded Medicaid to the working poor in Louisiana. Because of that decision, many more people, hundreds of thousands, have had access to primary care physician and the ability to afford prescription medication in order to treat or control underlying conditions that make them more vulnerable to COVID. I know that we still have a lot of work to do in order to improve health outcomes, but I can't imagine how many more people would have died this past year if not for the Medicaid expansion. Another way we've established groundwork for a more resilient Louisiana is through the creation of a Climate Initiatives Task Force last year. No state in our country is more adversely impacted by climate change than Louisiana. But at the same time, no state is better positioned to be a leader in reducing carbon emissions and bolstering coastal resiliency. By 2050, our goal is to reduce carbon emissions to net zero and to have invested $50 billion in rebuilding Louisiana's coast. The reason I know we can get there is because we are working with, not against, the energy sector that sustains so much of Louisiana's economy. Oil and gas production in the Gulf of Mexico continues to be important to Louisiana's success, and by working with these companies on a forward-thinking basis and to find solutions like carbon capture, we are going to make Louisiana more sustainable while also unlocking a whole new sector of economic and job opportunities.